Hello everyone, welcome back to this MLA content map walkthrough. Today we're going to walk you through ophthalmology, a very important topic in the case of your multiple choice questions and your OSCE stations, like all the topics here. But in the case of ophthalmology, what you need to know is that in your OSCE exams, this may be a combined station, okay? A combined station. So what that means is you'll have to do some kind of examination in these cases. And more often than not, that is a fundoscopy. So learn how to do fundoscopy really, really well. And this is something that you might have to do in addition to taking the patient's history and giving them the management. So acute glaucoma very commonly shows up in exams. Know the ins and outs of acute glaucoma. Uh, very, very commonly tested. Benign eyelid disorders. Uh, Again, something that is commonly tested. They could give you pictures of blepharitis or something to do with the eyelid. So do that well. Blepharitis right here, right? So yeah, look at pictures of this. Cataracts, also something that is very commonly tested. Know the risk factors of developing cataracts in the presentation. Know what you're going to do for the patient. One other thing that you need to be wary of in the case of ophthalmology is DVLA. Very important in these cases. You need to tell the patient that they need to avoid driving. Central retinal arterial occlusion. Know which patients show up with this. You need to know the fundoscopic findings in this case as well. Chronic glaucoma, like acute glaucoma, is very commonly tested. No difference between the two. Conjunctivitis could show up as neonatal conjunctivitis or adult conjunctivitis, pink eye, viral, bacterial, know the difference, know what you're going to do. Diabetic eye disease, cataracts, right? Or neovascularization in the retina, infective keratitis. Know how you're going to see this on the cornea and how this is going to show up. This has shown up in the past. Iritis. Know how the presentation of this. Know how you're going to diagnose this. Macular degeneration. So age-related macular degeneration. AMD or ARMD is something they like to test you on, the wavy lines and how you're going to counsel the patient because this is something that cannot be cured. Optic neuritis, in the case of multiple sclerosis, shows up a lot. Periorbital and orbital cellulitis may show up as an emergency scenario as well. Retinal detachment, very important. You need to know how retinal detachment shows up. This is also an emergency, and know the presentation for this. Scleritis is something that has shown up more commonly in the past, so do it well. Thyroid eye disease, so exophthalmos, right, is something that may show up. Lid lag is something you should know. Uveitis, know how this differs from iritis, okay, as well. And visual field defects. This is something they love to test you on, okay, so visual field defects. Nerve, chiasma, tract, where the lesion is exactly, they want you to localize the lesion in these cases. Craniopharyngioma, pituitary tumors, do it in that context really, really well. Okay, so presentations, now that we have a little bit of time, we can go through this as well. Acute change in or loss of vision. So this is usually how the patient presents, some kind of blurring of vision, loss of vision, could be sudden, could be gradual. Allergies, right, in the case of watery eyes, red eyes, right? Diplopia, in the case where a patient's extraocular muscles are affected, nerves are affected, okay? Eye pain and discomfort, again, glaucoma, could be an infection. Eye trauma. I haven't seen eye trauma show up. I haven't seen this show up in the past as much, but yeah, you should know that this could be a differential in all these different eye cases. Next, you have facial and periorbital swelling. Could show up in the case of cellulitis. Next, you have flashes and floaters in the visual fields. Retinal detachment could show up in this way. Foreign body in the eye. This is something that, again, I have not seen show up as much in exams, but again, it is an important differential. Gradual change or loss of vision in the case of chronic glaucoma, in case of cataracts, in case of ARMD. Loss of red reflex, know when this shows up, okay? Red eye, right? There are a number of cases where a red eye could show up. Apart from ophthalmology, could show up in the case of headaches, so your cluster headaches as well. Squint. This is important to know the cover and cover test. Okay, know how you're going to diagnose a patient with squint. So yeah, that's ophthalmology. Does tend to show up in exams. Sometimes they miss it. Sometimes they don't test you on this in your OSCE stations. Definitely shows up in your multiple choice question stations. You'll at least get some MCQs on this. In your OSCE stations, could show up, maybe won't show up, but just do it well as a combined scenario. Okay, so know how to manage your time in those cases. Hope this helped. See you next time.